Beacon Press Audio presents What Doctors Feel, How Emotions Affect the Practice of Medicine by Danielle Ofri. This audiobook is narrated by Arndt with an afterword by me, Danielle Ofri. Published by Beacon Press Audio 2021.
Chapter 1. The Doctor Can't See You Now. Which one would she be? I hovered by the door to the emergency room, my eyes darting from one patient to the next. As a first-year medical student whose entire medical career thus far had existed inside cavernous, windowless lecture halls, the chaos of the ER and my role here terrified me. I gazed at a shivering Hispanic teenager in jeans and a sweatshirt, filling out forms with a nurse. Was it her? I saw a college-age Asian woman in a heavy overcoat following an orderly to radiology. Was it her? There was a lumpy form curled up on a stretcher in the far corner. Perhaps that was her. Would it show? 3 months before, I'd signed up to be a volunteer rape crisis counselor at Bellevue Hospital. Along with a half a dozen other medical students and a sprinkling of hospital employees, I'd sat through a 6-week training program on how to support a victim of sexual assault through the difficult ER experience, how to act as an advocate, sometimes as a buffer, during the interactions with doctors, nurses, police, family. Each morning, the beeper was passed from one volunteer to the next. "Did you get called?" we asked each other anxiously. The very act of carrying a beeper, of being potentially responsible for something, made us all nervously excited. At 3:00 a.m., a beeper went off for the first time ever in my life, a searing jumble of excitement and terror. I frantically pulled on clothes and then sprinted over to the hospital in the darkness. And now, standing by the door, peering in at this bizarre hive of activity, I fought to settle my jangling nerves. How would I find her? What would I say to her? What exactly qualified me to be in this role? I took a deep breath, then stepped tentatively into the swirl of bodies and business, heading toward the triage desk. I found the charge nurse and explained why I was there. She grabbed a clipboard and scanned the names, pressing the eraser end of a pencil to the corner of her lip. "Josephine Hamlin, that's yours," she said finally, inclining the pencil toward a disheveled black woman a few feet away. "GYN's already been here, just needs to get cleaned up." The woman was clearly homeless, with shaggy, matted hair and dirt-encrusted clothing of indeterminate color. She sat hunched on the edge of the stretcher, her gaunt legs drooping toward the floor, feet stuffed into unlaced construction boots without socks. The weather-beaten cragginess of her face obscured her age. Desolate eyes stared vacantly into space. Her body appeared frozen in mid-breath. Whether inhalation or exhalation, it was impossible to tell. Gingerly, I took several steps toward her. As I drew closer, a pungent odor enveloped me, the fetid smell of an unwashed body and moldering clothes. I pressed forward, despite the nausea that was gathering at the back of my throat. Then a faint movement near her shoulder caught my eye, and I stiffened in my spot as a roach emerged from a fold in her threadbare sweater. It paused, as though taking in the scene, then sauntered placidly down her arm. It hesitated midway, and then finally rounded her elbow and disappeared into a layer of clothing. I stood frozen, my stomach clenched to keep its contents in place. My eyes raced from corner to corner of the ER, searching for someone or something to tell me what to do. I tried to step forward, but my legs wouldn't budge. The grimy smell seemed to intensify, surging in brackish waves that threatened to drown me. I knew that I had to swallow it all back, that I had to continue my approach toward this woman. This is what I'd signed on for when I enrolled in medical school, to help patients in need no matter who they were or what they looked like. The Hippocratic Oath, the oath of Maimonides, this was what these professional oaths were written for. Yet my body refused to move. The revolting smell, capped by the appearance of a genuine New York City roach, was simply too much for me. I could tell from the unaltered blankness of her stare that I hadn't yet registered on her horizon, that I was still part of the blur and buzz of the emergency room, that there was still time to hide. I groped behind me and inched backward until I reached the triage desk and could squeeze my inadequacies safely behind the Formica counter. I sank into a 1950s-era office chair and covered my mouth with my hands, unsure if I could keep from vomiting. Panicky thoughts jittered through my mind. What was I going to do? This was my residency patient, after all. This was a human being who had just been violated in the most horrible manner. It was my job to go there and help her. This was what it meant to be a doctor. Yet all I could do was cringe behind the desk, gutlessly pretending to examine paperwork. It's not that I was obsessive about cleanliness or needed everything to be pristine. By this point in my academic career, I'd dissected pigs, frogs, sheep brains, cow eyeballs. Even prior to medical school, I'd dissected plenty of human cadavers, having been an undergraduate teaching assistant in both anatomy and neuroanatomy. I was completely at ease with bisected pelvises and cross-sectioned livers. During my PhD research in neuroscience, I pulverized cow brains from the local kosher butcher and beheaded live mice by the dozen. Squeamish I was not. But the rancid smell of this patient undid me, and cockroaches had somehow never been subsumed into my childhood passion for all things animal. The combination thereof activated a primal revulsion that I simply could not quiet with my rational thoughts. 3 minutes later, a nurse's aide, an older Haitian woman, approached the patient. The aide reached out and took the patient's hand in hers. She spoke softly, and I watched as she coaxed the patient's gaze up to hers. The aide reached out her other hand and gently smoothed the patient's stiff, tangled hair. Slowly the patient stood, listing slightly to the left. The aide stepped in closer, supporting the woman as they began walking toward the shower room, their heads nearly touching. As they passed the triage desk, I could hear the aide's encouraging voice. "You'll feel so much better after a shower, and we can get you some fresh clothes." The aide's arm was secure around the patient's shoulders. "I know a quiet place where you can rest afterward. Don't worry, I'll stay with you." I sat hidden behind the desk, awed and humbled. As their distance from me grew and the potent stench concomitantly receded, I could finally exhale. I sank back in my chair, realizing how much I needed to learn about medicine. When I look back at my medical training from my current vantage point, nearly 3 decades from that moment in the ER, I can pinpoint seminal moments of clinical development. The first time jumbled susurrations in the earpieces of my stethoscope organized themselves into an identifiable cardiac murmur. The first time a glistening newborn was guided into my gloved and apprehensive hands. The first time a needle guided by my fingers punctured a human being's skin. Each of these moments represented another rung on the steep ladder of medical training and was, in fact, transforming. After each hurdle, I was not the same person as before. I was one step closer to becoming that still murky image of a doctor, and one step farther removed from the unformed student who had entered medical school. These epical experiences were so momentous that I can still remember the details of the place where each one occurred, and, more important, I remember each teacher who guided me through. That moment in the ER with the nurse's aide was another of those formative events of doctorhood. I was experiencing a most visceral lesson in empathy. That aide's act of compassion left me breathless. I knew that she was smelling the same stink I smelled, seeing the same grime and wretchedness. Yet she went to the woman without any evident hesitation. She not only stepped forward, but also gave of herself to the patient. In that moment, she personified for me what it meant to be a caregiver. To have compassion, literally as its Latin roots suggest, to be able to suffer with, one must have empathy. It is impossible to fake compassion. Empathy is a necessary prerequisite. Empathy is one of those odd concepts that is so central to human interaction, so obviously a requirement in medicine, something we intuitively know when we see, yet so difficult for many to precisely define. For now, I'll sidestep the detailed philosophical discussion about whether empathy is an emotion or a cognition, and stick with how most people define it: the ability to see and feel.
Sample complete. Ready to continue?